The title of my project was Improving Well-Being for Police Violence Victims Through Community-Based Support Group. My name is Brittany Johnson, and I attended Azusa Pacific University in the Masters of Social Work program for 2022. My project was created based on my internship at an agency for domestic violence called the YWCA. The agency recently created a new department titled Racial and Gender Equity. This newly developed sector currently advocated for the city of Glendale, Pasadena, to cease the use of racial profiling as a police tactic. When police officers inflict trauma, this is interpersonal trauma, racial trauma, and complex trauma that minorities must endure on a daily basis. This prompted the idea to provide a 6-week trauma-informed psychoeducational group for police violence victims to see if they would increase their self-reported mental well-being and knowledge of trauma in participants. The study consisted of planning, which conducted needs assessments for the group, and there was also a screener created. The next step was implementation, which was distributing flyers to the agency and the community via social media. Then there were 90-minute psychoeducational groups conducted for 5 weeks. The means was created using pre- and post surveys to collect quantitative data on knowledge and well-being, and weekly questionnaires for session feedback. Last, the data was analyzed using SPSS and weekly questionnaires interpreted using thematic analysis. The study examined participation in a psychoeducational group that focused on trauma, structural racism, coping skills, and resources or supports available within the community. The study consisted of 5 sessions where participants were given weekly questionnaires to assess for overall group satisfaction to the presentation and its components. The research sample consisted of a total of 8 participants referred by the agency and the community Black Lives Matter Pasadena. The study used a convenient sample of participants to voluntarily answer questions on a pre- and post survey. The survey rated the participants on a Likert scale. 1 equaled strong disagree, disagree, neutral, agree, with 5 equaling strongly agree. Regarding knowledge of trauma and effects, structural racism, resources, and coping skills. The post-survey was the same in addition to 3 questions pertaining to overall improvement. The weekly questionnaire consisted of 4 open-ended questions that allowed the participants to provide their own feedback. The pre- and post-mean data were compared for change. So the findings. The research shows that although not a significant change, the participants pre-survey did begin pretty high, and the post-survey showed a slight increase in 3 of the 4 participants. The thematic analysis revealed 2 themes: positive connections and the desire for more groups. The overall satisfaction of the group content and format seemed to be very high, with an overall mean of 4 out of 5. The group stated that they formed greater social connections and learned more about supports and resources available within their community. Although there's no significant change, the participants reported that they really enjoyed the group and the topics covered, systematic racism being really informative to them. They also provided ideas to each other on ways to cope and challenge such an oppressive system. I believe the short amount of time and being on Zoom were barriers to the group. I recommend that further research be conducted with longer group sessions and more participants. So in conclusion, it was revealed that further research should be conducted with more sessions and participants. Overall, the group provided the community with a safe space to heal, learn, and empower others who have been victims of police violence. This project will be sustained in the agency by placing the project, all of its slides, findings, measurements, and outcomes in their pile for potential services for the new department. The project's results can be a guide and offer recommendations for future facilitators of this group. In conclusion, we all need a safe place to heal and overcome trauma. Last but not least, I would like to acknowledge my professor, Tiffany Saucer of Azusa Pacific University, my internship supervisor, Nicole Cherry of YWCA Glendale, Pasadena, my school, Azusa Pacific University and the School of Social Work, and last but not least, Western Region Public Health Training Center, for allowing me to give this project my time and dedication.